Hello and welcome to Medical Terminology. This week we are going to discuss Chapter 7, the nervous system. Let's get started. Learning outcomes for this chapter include 7.1, identify the parts of the nervous system and discuss the functions of each part. 7.2, recall the major word parts used in building words that relate to the nervous system. 7.3, identify the common diagnostic tests, laboratory tests, and clinical procedures used in testing and treating disorders of the nervous system. 7.4, define the major pathological conditions of the nervous system. 7.5, explain the meaning of surgical terms related to the nervous system. 7.6, recognize common pharmacological agents used in treating disorders of the nervous system. And finally, 7.7, we will identify common abbreviations associated with the nervous system. All right, let's begin with learning outcome 7.1, structure and function of the nervous system. Our nervous system directs all human body systems. It monitors both voluntary and involuntary actions. We have more than 100 billion nerve cells. And our nervous system is broken down into two subsystems, known as the CNS and the PNS. So we have central nervous system and the peripheral nervous system. All right, let's look at a nerve cell. First, you can see we have the axon. The axon acts kind of like the highway for the impulses to travel, and that myelin sheath acts like a cable insulator. So the more insulated, the farther that impulse can go. With diseases such as MS, when that myelin sheath starts breaking down, then that impulse doesn't make it all the way to where it's supposed to go, and that's when things like urinary incontinence can happen. Then we have a fascicle, which you can see there's multiple different axons in there. Then they run parallel with the blood vessels. All right, central nervous system. It coordinates the activity of the brain, spinal cord, and sense organs, such as eye. The peripheral nervous system consists of peripheral nerves that branch out from the brain and spinal cord and connects the central nervous system to the limbs and organs. Building our vocabulary. So here we have cephalo. Cephalo means head. Cerebello means cerebellum. Cerebro or cerebri means cerebrum. Cranio means your cranium, skull. Encephalo, that's your brain. Ganglio is a ganglion. Glio as neuroglia. Meningo or meningeo is the meninges. Then we have myelo, which means bone marrow and spinal cord. Remember, I don't want you to confuse this with myo, which means muscle, or myco, which means fungus. Myelo is bone marrow or spinal cord. Then we have neuro or neuri, which is nerve. Spino or spino, which is spine. Then we have thalmo, which is the thalamus. Vago is the vagus nerve. And finally, ventriculo, which is the ventricle. The central nervous system consists of the brain and spinal cord. The brain has different areas with distinct functions. Functions that receive, process, or respond. All right, here's an image of the human brain. Let's break it down a bit. So the structures of the brain shows clockwise labeled as spinal cord, medulla, pons, midbrain, pituitary gland, hypothalamus, frontal lobe, tissue dividing lateral ventricles, cerebrum, parietal lobe, the thalamus, corpus callosum, occipital lobe, pineal body, cerebellum, and central canal of the spinal column. Let's look at the centers of control and what they do. So here we have 14 labeled parts along with 4 major lobes. We're going to go clockwise as follows. We're going to begin with the temporal lobe, which has the responsibility of interpretation of auditory patterns. The lateral sulcus is there. Motor speech area, such as the Broca's area. Then we have the frontal lobe. This is responsible for the auditory area, the frontal eye field, concentration, planning, problem solving, motor areas involved with the control of voluntary muscles. The central sulcus is here, It's also involved with the sensory areas involved with cutaneous and other senses. Then we have the parietal lobe, responsible for sensory speech area, such as vernix area. Then we have the occipital lobe, which is responsible for combining visual images, visual cognition of objects, and the visual area. Then we have the cerebellum and the brainstem. The cerebellum is responsible for muscle control, including your balance and movement. All right, spinal cord and meninges. The spinal cord extends down from the occipital bone to a space between the first and second lumbar vertebrae. Functions of the spinal cord include sensory impulses to the brain, motor impulses from the brain, and it coordinates certain reflexes. Meninges. Meninges are the covering of the brain and the spinal cord. Let's look at the shape and parts of the spinal cord. So here you can see we have the human brain. You can see where the brain stem goes through an opening in the skull called the foramen magnum. It extends down where you can see the cervical enlargement. On down you'll see the spinal cord is the cream colored, and then the brown colored is the vertebral canal. Then we have our lumbar enlargement right before the conus medullaris, and finally we have the cauda equina. Here we have a detailed spinal cord structure. So you can see in the middle here we have the white matter which surrounds the gray matter. Then we have our posterior roots, which come from the back of the spinal cord, and then we have our anterior root, which comes from the front of the spinal cord. Now you'll see these different layers that wrap the spinal cord. So this first layer is called the pia mater. Then we have the arachnoid, which is more like a mesh, like a web. Think of a web, that's why it's arachnoid. And then finally we have the dura mater. Think of it as durable. Peripheral nervous system includes a network of nerves that branch off brain and spinal cord, include the cranial and spinal nerves, and then within that we have two subsystems. The somatic nervous system, which receives and processes sensory input from the skin, muscles, tendons, joints, eyes, tongue, nose, and ears. They also excite the voluntary contractions of the skeletal muscle. Then we have the autonomic nervous system, which carries impulses from the central nervous system to glands, various smooth muscles which are involuntary, cardiac muscle, also involuntary, and various membranes. The autonomic nervous system stimulates organs, glands, and senses by stimulating secretions of various substances. All right, let's break down the peripheral nervous system. So here we have a posterior view of the human body. Shows the spinal nerves categorized into 5 regions as follows. The top 8 cervical nerves are located in the cervical region and are marked as C1 through C8. The next 12 thoracic nerves are located in the thoracic region or the chest region and are marked as T1 through T12. Then we have the 5 lumbar nerves, which are located in the lumbar region and are marked as L1 through L5. We also have 5 sacral nerves that are located in the sacral region and are marked as S1 through S5. The last nerve is the coccygeal nerve, and it is marked as CO. The cauda equina, which is a group of nerves located at the end of the spinal cord. Now we're going to learn a bit about what each cranial nerve does. What is the function? So as you can see here, the first cranial nerve is the olfactory, which is a sensory nerve, and this controls our sense of smell. Then our second cranial nerve is optic. It's a sensory nerve as well. This is responsible for our sense of vision. Cranial nerve 3 is oculomotor. So this is a motor nerve, and this is responsible for the movement of the eyes. Remember, oculo is our word part for eyes. Then we have a cranial nerve 4, which is trochlear. It's a motor nerve. This is responsible for muscles that move the eyes. And then we have trigeminal, which is the 5th cranial nerve. You might hear a term called trigeminal neuralgia. That would be including this 5th cranial nerve, which is a sensory and motor nerve. And it is responsible for eyes, tear glands, scalp, forehead, teeth, and mouth. Remember, our correct word for tear glands is lacrimal glands. And then we have the 6th cranial nerve, and this is the abducens, which is a motor nerve, and this is responsible for muscle conditioning. Then we have our 7th cranial nerve, which is facial. This is a sensory and motor. It's responsible for taste, facial expressions, tear and salivary glands. Our eighth cranial nerve is known as the vestibulocochlear, and it is a sensory nerve, and this is responsible for our equilibrium and hearing. And our ninth cranial nerve is glossopharyngeal, which is a sensory and motor nerve, and it's responsible for the pharynx, tonsils, tongue, carotid arteries, and salivary glands. And then finally, we're going to go over cranial nerves 10 through 12. So our 10th cranial nerve is the vagus nerve, and this is sensory and motor. It is responsible for speech, swallowing, heart muscles, smooth muscles, remember those are two involuntary groups, and certain glands. And then we have the 11th cranial nerve, which is an accessory nerve, and this is a motor. This one's responsible for the soft palate, pharynx, larynx, neck, and back. And then we have the hypoglossal, which is a motor, and this is responsible for the tongue. Remember, all is pertaining to, hypo is below, glosso is our word part for tongue. So this is pertaining to below the tongue, which is where that nerve is. All right, major spinal nerve divisions and their functions. So first we have cervical, which is in the neck area, and this is responsible for muscles of the back of the head, neck, and diaphragm. Then we have brachial, which is in the lower neck, and axilla. Axilla are our armpits. And these are responsible for muscles and skin of the neck, shoulders, arms, and hands. Then we have lumbar, which is our posterior abdominal wall, and that is our abdominal skin and muscles area. And then we have sacral, which is posterior pelvic wall, and it's responsible for muscles of the buttocks, thighs, feet, legs, and voluntary sphincters. And then lastly, we have the coccygeal, which is in the coccyx and surrounding area, and it's responsible for skin in the coccyx region. Learning outcome 7.2, word building in the nervous system. So here we have encephalitis. Encephalo we know is brain, itis we know is inflammation, therefore this is the inflammation of the brain. Vagotomy, this is a surgical severing, that tomy, right, that's that surgical incision of the vago, which is the vagus nerve. So we are surgically severing the vagus nerve. Cerebellitis. So this is itis, inflammation. Cerebello, we know is the cerebellum. So this is inflammation of the cerebellum. Ganglioniform. So this is having the shape of the ganglion. So form would be that shape, and ganglio would be that ganglion. It's more like a cyst shape. Then we have ventriculitis, inflammation of the ventricles of the brain. Neuritis is inflammation of a nerve. Craniofacial, related to the face and the cranium. Remember, all is pertaining to cranium, facio, face. So that's where we are pertaining to the cranium and face, technically, not the face and cranium. This would be backwards if you were doing your definition. The myelomalacia, the softening of the spinal cord. So malacia is our word part for softening, and myelo is that spinal cord. Then we have gliomatosis. Gliomatosis is an abnormal growth of neuroglia in the brain or spinal column. Thalamotomy is an incision into the thalamus to destroy a portion causing or transmitting sensations of pain. Cephalalgia. Algia is our word part for pain. Cephalo we know is our head. This is a headache, so pain in the head. Meningocele, a protrusion of the spinal meninges above the surface of the skin. Learning outcome 7.3, diagnostic, procedural, and lab terms. Findings assist physicians in diagnosing related medical conditions. Tests lead to final diagnosis, and tests can also assist in the treatment planning. Tests like an electroencephalogram or EEG, evoked potentials, nerve conduction velocity, and polysomnography, PSG. All right, learning outcome 7.4, pathological terms. So these can be trauma, so traumatic, isolated incidents, or congenital. Think of Maybelline. Maybe you're born with it, that's congenital. So traumatic or congenital disorders can affect the nervous system. The level of severity is going to determine how much it affects life. So we have a concussion, which is an entire injury to the entire brain, and then coma and brain contusion. Now contusion is our word for bruise, right? So this is just an isolated area in the brain that is affected. That is a brain contusion. Then we have spina bifida, meningocele, meningomyelocele, Tay-Sachs disease, and hydrocephalus. And we do know hydro means water. Hydro with a Y means water. Hydro with an I means sweat. So this is water on the brain. All right, degenerative nerve diseases. They're usually serious or life-threatening. They can be genetic. They can be caused in the age processing, or they can be due to lifestyle choices. There is no cure, however, we can treat the symptoms. The main point of treating the symptoms is to decrease pain and to keep mobile. Let's go over some of these degenerative diseases. So we have dementia, Alzheimer's disease, amnesia, apraxia, agnosia, amyotrophic lateral sclerosis, ALS, also known as Lou Gehrig's disease, Huntington chorea, and multiple sclerosis, which you've probably heard referred to as MS. We also have demyelination. Remember, this was when that myelin sheath was covering the axon, and now that it's demyelating, which means that myelin sheath is breaking down. So therefore, that pathway for that nerve is not going to be nearly as strong as before. So your impulses might not fully get to where they're supposed to go. And then gait, that has to do with your walking. Paresthesia, myasthenia gravis is a weakening. Parkinson disease, and dopamine. Now let's look at some non-degenerative nerve disorders. So severe neurological disorders cause paralysis, convulsions, and other symptoms, but are not necessarily degenerative or congenital. These include palsy, cerebral palsy, Bell's palsy, ataxia, epilepsy, aura, absent seizures, petit mal seizures, tonic-clonic seizures, grand mal seizures, and Tourette syndrome. Then we have infections and inflammations, which these of the nervous system can be very serious and even deadly. Symptoms usually equate to pain or skin conditions such as shingles, meningitis, pyrogenic meningitis, bacterial meningitis, viral meningitis, neuritis, myelitis, encephalitis, cerebellitis, gangliitis, radiculitis, and sciatica. Abnormal growths. Nearly 1/3 of all brain tumors have metastasized from other parts, which means there was cancer in some other area of the body and it metastasized or spread to the brain. The remaining tumors can be benign, which means non-cancerous, or they can be malignant, which means it is cancerous. These growths can cause pressure and distortion, which increase those neurological symptoms. Let's look at vascular disorders. So these can cause significant changes in a person's lifestyle. Depending on the severity, they can also be deadly. So we have cerebrovascular accident, CVA. This is also known as a stroke. Then we have cerebral infarction, thrombus. Remember, that's a blood clot that's in place. That's important to know. A thrombus is in place. Occlusion. And then we have thrombotic stroke, transient ischemic attack, TIA, which is also known as a mini stroke, and then embolic stroke. We also have embolus. Embolus is a thrombus that is dislodged. Now it's traveling the circulatory system, which this can also cause a stroke because once it gets to a branched off area in the vein that's not quite big enough for it to pass through, it will stop that and no more blood flow will get to what's behind the embolus. That's how that works. Then we have hemorrhagic stroke, aneurysm, which is a weak point in the vessel. This can appear several different ways. I think there's 3 main types of aneurysms. And then dysphagia, aphasia, fainting, syncope. I know it looks like syncope, it's not. Syncope, somnolence, and narcolepsy. 7.5 surgical terms. Surgery on the nervous system is performed to treat related diseases and disorders. However, surgery is high risk due to the potential for permanent injury. Let's look at some of these surgical terms. We know our neurosurgeons are the ones performing these surgeries. Then we have lobectomy, lobotomy, craniectomy, craniotomy. Remember, otomy or that tomy is that surgical incision, and ectomy is that surgical removal. And then we have stereotaxy, stereotactic surgery, neuroplasty, neurectomy, neurotomy, neurorrhaphy. Remember, rhaphy is our word part for suturing. And then vagotomy. Learning outcome 7.6, pharmacological terms. Medications may be used to treat neurological disorders and diseases. In fact, many neurological medications may treat more than one neurological condition. These can include analgesics, anticonvulsants, narcotics, sedatives, hypnotics, and anesthetics. And let's wrap it up with Learning Outcome 7.7 abbreviations. So here we have ALS, again, which is amyotrophic lateral sclerosis, or Lou Gehrig's disease. CNS, central nervous system. CSF, cerebrospinal fluid. CVA, cerebrovascular accident. Remember, this is a stroke. EEG is electroencephalogram. ICP, intracranial pressure. Then we have MRA, magnetic resonance angiography. MRI, magnetic resonance imaging. PNS, peripheral nervous system. SCI, spinal cord injury. If you work in an ER, you might see that on a chart. Then we have TENS, transcutaneous electrical nerve stimulation. TIA, trans-ischemia attack. This is a mini stroke. All right, let's wrap up. In review, we know in 7.1 we learned that the nervous system directs the function of all human body systems. The nervous system is divided into two subsystems known as the central nervous system and the peripheral nervous system. 7.2. Word building requires knowledge of combining form and meaning. 7.3. Diagnostic, procedural, and laboratory findings assist the healthcare provider in diagnosing medical conditions. Often used in combination, these tests lead to final diagnosis and assist in treatment planning. 7.4. Pathological conditions of the nervous system can include trauma and congenital disorders, degenerative and non-degenerative conditions such as paralysis, convulsions, infections, inflammations, vascular disorders, tumors, and growths. And 7.5, surgery is performed on the nervous system to treat a variety of diseases and disorders. Remember, surgery on the nervous system is always high risk due to the potential for permanent injury. 7.6, medications may be used to treat neurological disorders and diseases. And as we said before, many neurological medications may treat more than one neurological disorder. And finally, 7.7. Abbreviations are commonly used to describe diseases, diagnostic procedures, and treatments of the nervous system. All right, everyone, thank you so much for joining me. That is all I have for you today. Please let me know if you have any questions. Thank you so much.